This is the world premiere of the Is Alzheimer's Preventable program, which I hope to sell to 137 people in 137 countries. A lot of it is based on a book called The End of Alzheimer's by Dale Bredesen. And it's a UCLA scientist that did a study on 10 patients with mild to moderate Alzheimer's. 90% of them recovered their memory and ceased their symptoms dramatically. And that was 2.5 years ago, and all of them have improved since then. Only one patient did not benefit. That was the person with the most severe case. And this goes to my argument, which you'll see later, about how cells deteriorate in the body, and how if you catch things soon enough, you don't have to experience these illnesses. And so
they had these folks in this trial were all early stage.
No, they were mild to moderate. They were before early. They were after early, rather. They were already mild diagnosed, mild to moderate Alzheimer's. And so they were already showing many symptoms. And they were already failing most of the standardized tests. So they were serious candidates.
What is your opinion on that company that just Astravant, I think it is, or Astravant, that just failed its Alzheimer's trial?
They're in a very unselect group. There's been like 200 of those studies in the last 15 years, and 99.6% of them failed. And the 4.4% that succeeded, the benefit was so marginal that it didn't cease one symptom, and it didn't extend the life of one Alzheimer's patient. So we're talking about basically 100% failure rate because it's monotherapy. We're going to get into that. It's one disease and one drug just doesn't get it done. All right. So let's introduce this very quickly. The first case of Alzheimer's was Alzheimer 1906, and subsequent research identified 7 different variations. Linus Pauling, actually in the 1950s, along with Abram Hoffer and a few other guys, started a thing called orthomolecular psychiatry. They actually hypothesized that all of these brain-related illnesses were probably due to something we were eating or not eating. So they started this whole orthomolecular psychiatry thing, which has evolved to what we now know to be functional medicine, which is the same thing about the intake and outtake. So these are some of the people that sort of led the way: Pfeiffer, Hoffer, Braverman, Matthews, Larson, Daniel Amen, David Perlmutter, and Dale Bredesen. All conventional approaches are based to one monotherapy approach, and that's why we've had 100% failure, because that's not the way the body works. Building on the work of Linus Pauling and all these others, Bredesen used a multifactorial approach. He found 36 different things that he calls the holes in the roof. 36 different things that are the causal factors of Alzheimer's. And you had to fill all 36 holes in order to get a really effective leakage elimination problem. And so that's sort of an overview. The following research program is based on all this 70 years of research. This is Dale Bredesen's abstract of the magazine article that he wrote in Aging, where Alzheimer's disease is one of the most significant healthcare problems nationally and globally. The first description of reversal of cognitive decline in patients with early Alzheimer's and its precursors was published. And I gave you the summary already. So 9 out of 10 patients improved significantly, went back to work, and are doing fine. And so this was groundbreaking, because this had never been done before. Now, I understand from my colleague at the end of the table and his wife that there were some doctors, and I know some of them, that were getting some pretty nice results from doing some of this. And they were getting some prevention, they were getting some symptom reduction, and so forth and so on. So it's not like this handful of guys did it all. It's like 50, 100, 200 doctors around the country, around the world, have been doing this for a long time. They just didn't get the program developed as far as Dale Bredesen did. And that's why he got these results. He took all of their research and all of the research from the other doctors for the last 70 years and synthesized it and got it down into one protocol. That's what he did. So by taking this course, and then remember, you're the guinea pigs, so I'm treating you like you're people all over the world, South Africa, Germany, Australia. So I'm going to give you an overview of the course. we're going to talk about how Alzheimer's develops and how to calculate risk 5 to 10 years earlier than the existing symptoms-based analysis. How to assess the quality of nutritional intake generally and for the brain specifically. How to evaluate nutritional absorption based on challenges such as the presence of toxins, poor digestion, use of prescription meds, and other things. And by the way, the body thinks in most cases that prescription medications are toxins. That's what they see, that's what they understand. Does that mean they don't all work? Absolutely not. Many of them do work and work very well. The one for Hep C is probably the strongest prescription medication that's ever been found because it can actually eliminate Hep C in 3 months. It costs you have to get a mortgage to take this prescription medication because it is really expensive. How to determine the nutritional and physiological challenges caused by stress, poor sleep, exercise, alcohol use, tobacco. Every one of these factors and the ones before causes your need for nutrients to go up. So you have a baseline where if you're sitting doing nothing for 24 hours a day, this is the level of nutrients that you need. But if you do any of these things, then you probably need more. We now know that from prenatal supplements, don't we? Pregnancy requires more. But guess what? The research originally to identify folate was done in 1967. But it wasn't until 1992 that Harvard did another study and found out that, oh yeah, folate is important, and so they started to use these prenatal vitamins. Well, Jeffrey Bland did an analysis of what happened between 1967 and 1992. 1.4 million people died unnecessarily because of the ignorance of that published study not being used by doctors. And I have 100 of those kinds of incidences where there was science, there was evidence, and it was ignored. The first evidence that vitamin E was good for your heart, 1948, two brothers in London. They wouldn't let the research go past the Canadian border into the United States. So, how to optimize proven Alzheimer's prevention strategies using high-quality nutritional supplements, since virtually impossible to get the levels you need from food alone, and how proven strategies for detoxification, stress reduction, inflammation reduction, sleep improvement, hormone and transmitter development, and improvement in physical and mental exercise is really important. They're all factors in preventing Alzheimer's. And how to take advantage of over 20 years of scientific research and medical expertise to create and sustain a healthy brain for a lifetime. Here's the other bottom line. If you follow this protocol, even half, you're probably going to eliminate or minimize your risk of any chronic disease, from cancer to Parkinson's to heart disease, diabetes. You're going to eliminate all of them. Almost 70 to 80% of every protocol for every disease has the same things in it. And it's always got one starting ingredient, vegetables. It's got to have the vegetables. And believe me, fruits and vegetables aren't the same. All right? Lots of fruits have too much sugar. So you've got to eat according to the glycemic index. Because there's only one food that's predominantly alkaline, mineral-based, and that's vegetables. Some vegetables are sugary too. Beets are sugary, carrots are sugary. But most vegetables are not. Most fruits are acidic because they're sugar-based. But if you go low on the index and get the ones that aren't as acidic, then they become alkaline foods. So in terms of people, my daughter-in-law used to say to me, well, the Canadian food pyramid says we should eat 5 helpings of fruits and vegetables a day, so it's okay if it's 4 fruits and 1 vegetable. And I go, no, it's not okay. It should be the other way around. It should be 4 vegetables and 1 fruit. Oh, she said, but the Canadian food pyramid says it's, I don't care what they say, they're lying, or they don't know, or a combination of the two. So, yes. And the argument with people who say, well, I get colds and flus, but I take orange juice all the time. Well, good for you. That's the way to feed your cold. That's the way to feed your flu. Whatever you want to do, make sure you get more sugar in there in the forms of juice, because that'll certainly help you. You maybe get 30 or 40 milligrams of vitamin C. That's wonderful. But the sugar you're getting is not worth the amount of vitamin C you're getting. You'd have to eat a bushel of oranges in order to get enough vitamin C. And by that time, your top of the head is just going to blow off from the sugar, and you'll get pancreatic cancer and die. So we can edit all that, but I feel obliged sometimes to say it anyway.